Myofascial release, transverse friction massage, foam rolling, and instrument-assisted soft tissue mobilization are manual therapy techniques that are commonly used by clinicians to relieve pain and help break up tissue adhesions. Myofascial release is a technique that is used to relieve pain in order to improve function and for tissue adhesions and tenderness. This is best attained when myofascial release is used in conjunction with other therapies. It uses long load and duration forces in order to change myofascial tissue that binds all types of tissue together. There are two main types, indirect and direct. Indirect involves the practitioner's hands moving along the skin following the path of least resistance of fascia. Direct techniques involve strong pressure in order to slowly move into adhered fascia with the goal of releasing the adherents. This technique is important for therapists to be aware of a different way to alleviate pain naturally. The very basis of myofascial release is based on changing tissue properties, which is at the essence of what a PT does in many treatments. Myofascial release currently has very little objective data and no medical backing to support the cellular theories. Success is primarily based on the subjective relationship between therapist and patient, and results vary from clinician to clinician. Transverse friction massage was first performed by Dr. James Cyriax in 1930 with the goal of preventing abnormal adhesions and scarring. Today, transverse friction massage can be used for muscular lesions as well as tendinous and ligamentous lesions. It is also indicated for use in order to help improve muscular and ligamentous lesions by creating better alignment of the fibers and increasing tensile strength and maintaining connective tissue mobility. Transverse friction massage should be performed 3 times a week for about 10 to 15 minutes. If it is a chronic condition, 1 to 2 times per week for 20 minutes is acceptable. Treatments can be terminated when the patient is symptom-free and functional tests are negative. If this technique is performed properly, it will lead to the prevention of adhesions to help optimize the quality of the scar tissue, stimulation of mechanoreceptors to elicit temporary analgesia, and can help to evacuate pain triggering metabolites, all of which lead to better outcomes in healing and in physical therapy. TFM Research generally does not support the use of TFM in treatment and management of tendinitis. All studies concluded that there is not sufficient evidence to determine the effects of TFM in improving pain and function in individuals with various tendinitis injuries. Researchers are now interested in looking at outcomes of combined treatments of TFM and other modalities such as ionto or phonophoresis. Instrument-assisted soft tissue mobilization, or IASTM, is a technique that involves using instruments of tools to address musculoskeletal pathology-related impairments and help heal soft tissues. IASTM works by applying a stimulus to the injured soft tissue using an instrument or tool, causing localized inflammation to occur, and then the number of fibroblasts and fibronectin increases. This facilitates the synthesis and realignment of collagen, which makes up the extracellular matrix. The biggest goal of IASTM is to remove scar tissues and promote a return to normal function following soft tissue regeneration. Once the scar tissue around the injury is removed, the joint can begin to achieve functional normalization and regain range of motion and strength. This is relevant to us as physical therapists because it is a commonly used modality and can help treat a wide variety of conditions. There is evidence to support the use of IASTM for many different conditions. Further research is needed to understand the effects and why it can reduce pain and what treatment duration and frequency is best when trying to increase muscular force production. Foam rolling is a technique that is used as a self-myofascial release. Self-myofascial release aims to mimic the effects of manual therapy and tackle dysfunctions of the skeletal muscle and connective tissue. In addition to neuronal mechanisms, improved flexibility may be driven by acute morphological adaptations, such as a reduction in passive tissue stiffness or improved movement between fascial layers. Foam rolling is one of the most common techniques to perform self-myofascial release. Negatively affect neuromuscular performance, so the acute biomechanical mechanisms for increases in flexibility might differ. Knowledge of the effect on passive tissue stiffness and fascial sliding allows the clinician to determine the optimal timing for the use of SMR during warm-up, before competition, or during therapy to restore normal range of motion. Current literature measuring the effects of SMR is still emerging. Research suggests that SMR techniques can improve range of motion, but the effects on passive tissue stiffness and fascial sliding as possible influencing factors have not been evaluated yet. Foam rolling and roller massage may be effective interventions for enhancing joint range of motion and pre- and post-exercise muscle performance. However, due to the heterogeneity of methods among studies, there currently is no consensus on the optimal SMR program. There aren't many ethical issues with these manual therapy techniques. However, for IASEM, it can cause redness and bruising of the skin, so that needs to be monitored. Also, the PTs may sell foam rolls to patients directly or recommend the client to purchase and use at home, so the patients might feel obligated to buy it because they trust the PT or they feel uncomfortable refusing it.